Hello there, and welcome to Wise Elderly Tips. I'm so glad you've joined me today. Before we dive in, I want to address something important. We're going to be discussing a topic that might make some of you feel a bit uncomfortable at first. But I promise you, by the end of this video, you'll feel informed, empowered, and reassured about an aspect of health that rarely gets the honest attention it deserves. Have you ever wondered if continuing certain intimate self-care practices is still healthy as you enter your 60s, 70s, or beyond? Perhaps you've noticed changes in how your body responds, or maybe you've questioned whether this natural activity is still appropriate at your age. Or maybe you're simply curious about how these private moments might be affecting your overall health now that you're in your golden years. You're not alone in these questions. In my years of creating content for seniors, this topic consistently appears in private messages and emails, people wanting information but feeling too embarrassed to ask their doctors directly. That's exactly why we need to talk about it today. Understanding how your body responds to self-pleasure in your senior years isn't just about physical satisfaction, it's about maintaining your complete health picture, physical well-being, emotional balance, and intimate confidence. These elements remain important throughout our entire lives, not just in youth. By the end of our time together, you'll understand 9 crucial considerations that medical professionals want you to know about masturbation as you age. Some of what I share might surprise you, some might reassure you, and all of it will help you make informed decisions about this natural aspect of human health. Before we continue, I want to ask a small favor. If you find this information valuable, and I believe you will, please hit the like button. It helps other seniors find this important content. And if you'd like more honest, straightforward videos about maintaining intimate health as we age, comment, "I'm interested," below. Your engagement helps me understand which topics matter most to our community. And of course, if you haven't already, please consider subscribing to Wise Elderly Tips. We're building a community of seniors who believe that accurate information leads to better health decisions, no matter the topic. Now, let's begin our discussion of these 9 important considerations about masturbation for adults in their 60s and 70s, information that might just change how you think about this aspect of your health. 1. Cardiovascular considerations. Let me start with something many of you have likely experienced. Perhaps you've noticed your heart beating faster during self-pleasure than it did when you were younger. Maybe you felt slightly out of breath, or noticed that it takes longer to return to your resting heart rate afterward. If so, you're experiencing the natural changes in how your cardiovascular system responds to physical activity as you age. This isn't just your imagination, there's a medical explanation for these changes. As we move through our 60s and 70s, our cardiovascular system undergoes several natural transformations. Our blood vessels become less flexible, our heart muscle may thicken slightly, and our overall cardiac output can decrease by up to 30% compared to our younger years. These changes affect how our bodies respond to any form of physical exertion, including intimate activities. During sexual arousal and climax, your heart rate increases, blood pressure rises temporarily, and your breathing becomes more rapid. For a healthy person in their 30s or 40s, these changes happen efficiently and resolve quickly. In our 60s and 70s, these same responses still occur, but our bodies may take longer to return to baseline. Now, here's where many people misunderstand the situation. Some assume that any increase in heart rate during intimate activities is dangerous for seniors. This simply isn't true for most healthy adults. Medical research indicates that for most seniors without significant heart conditions, masturbation creates cardiovascular demands comparable to climbing 1 or 2 flights of stairs or taking a brisk walk. Activities that doctors generally encourage. For most healthy adults in their 60s and 70s, this temporary increase in heart rate poses no significant risk to. However, if you have existing heart conditions like angina, have had a recent heart attack, or experience chest pain during physical exertion, it's important to be cautious. If you have heart concerns, consider timing your self-pleasure during periods when you feel most energetic rather than when you're already fatigued. And remember, if you can comfortably walk up 2 flights of stairs without chest pain or severe shortness of breath, you're likely able to engage in self-pleasure safely. 2. Medication interactions. If you're like most adults in their 60s and 70s, your medicine cabinet probably contains at least a few prescription bottles. According to recent studies, the average American over 65 takes between 4 and 5 prescription medications daily. What many people don't realize is how these medications can affect our intimate experiences. You might have noticed changes in your desire for self-pleasure or in your physical response since starting certain medications. Perhaps arousal takes longer, sensations feel different, or reaching climax has become more challenging. This connection isn't coincidental. Many common prescriptions can affect both desire and physical response. Let me share some examples. Medications for high blood pressure, particularly beta blockers, can sometimes reduce blood flow to genital tissues, affecting arousal. Many antidepressants, especially SSRIs like fluoxetine or sertraline, are known to delay orgasm or reduce sexual desire. Some antihistamines can cause vaginal dryness in women, while certain medications for enlarged prostate can affect ejaculation in men. A common misconception I hear frequently is that seniors should simply accept these side effects as inevitable, that they're just part of getting older and taking necessary medications. In reality, there are often alternative medications or adjusted dosages that can minimize these effects while still treating your condition effectively. 5. Here's what I recommend. Consider keeping a simple journal noting any changes you experience in your intimate responses, and when you started new medications. This information can be incredibly valuable when discussing these issues with your healthcare provider. And yes, I know these conversations can feel awkward. But remember, healthcare professionals discuss sexual health every day. They've heard these concerns before and can often suggest solutions. You might say something like, "I've noticed changes in my intimate responses since starting this medication. Are there alternatives that might have fewer effects in this area?" The key message here is, don't suffer in silence. These effects are common, medical in nature, and often addressable. 3. Hormonal changes. Perhaps you've noticed that your body's response to self-stimulation isn't as predictable or as intense as it once was. Maybe arousal takes longer, or the sensations feel different. These changes are often connected to the natural hormonal shifts that occur as we age. For men in their 60s and 70s, testosterone levels have typically declined by 30 to 40% from their peak in early adulthood. This doesn't mean testosterone disappears. Most men continue producing this important hormone well into their 80s and beyond, but the reduction can affect everything from desire to physical response. For women, the hormonal changes of menopause bring significant reductions in estrogen, which can lead to vaginal tissue becoming thinner and less elastic, with reduced natural lubrication. These changes can make self-stimulation less comfortable without proper preparation. Many people mistakenly believe that decreased hormone levels mean the end of intimate pleasure. In reality, your body is simply adapting to a new normal that may require different approaches and expectations. The capacity for pleasure remains intact, but the path to reaching it might need some adjustments. For women, using appropriate personal lubricants can address dryness issues. 5. Water-based lubricants are generally safe and effective, though some women find that silicone-based products provide longer-lasting comfort. I recommend avoiding products with glycerin or artificial fragrances, as these can cause irritation in sensitive tissues, particularly in older adults. For both men and women, allowing more time for arousal can compensate for hormonal changes. The body's response time naturally slows with age, but with patience, the same pleasurable sensations are still achievable. Think of it as savoring rather than rushing, a different approach, but not a lesser experience. Some healthcare providers might discuss hormone replacement options in certain cases. For women, localized estrogen creams can help restore vaginal tissue health without the risks associated with systemic hormone therapy. For men with significantly low testosterone levels, replacement therapy might be considered, though it carries both benefits and risks that should be carefully discussed with your doctor. It's worth noting that hormonal changes don't just affect physical response, they can also influence desire. If you've noticed changes in how frequently you feel interested in self-pleasure, this is often connected to these same hormonal shifts. This doesn't reflect on your vitality or virility, it's simply your body's natural evolution. 4. Joint health and comfort. You may have experienced discomfort in your hands, wrists, or other joints during self-pleasure activities that wasn't an issue in earlier years. Perhaps you found yourself stopping due to pain rather than satisfaction. This is often related to the arthritis and joint changes that commonly develop with age. Arthritis affects approximately 49.6% of adults over 65, according to the CDC. That's nearly half of us dealing with some form of joint discomfort that can impact range of motion and cause pain during repetitive movements. Conditions like osteoarthritis, rheumatoid arthritis, or even the general joint stiffness that comes with aging can all affect your comfort during intimate activities. Many assume they must simply endure this discomfort or give up certain activities altogether. However, there are practical solutions that can help you maintain this aspect of your well-being without pain. First, consider your positioning. Using pillows for support can reduce strain on joints. For those with back pain or hip issues, lying on your side rather than your back might provide more comfort. For hand and wrist discomfort, changing the angle of movement or alternating hands can help distribute the strain. Timing is another important consideration. Consider engaging in self-pleasure after taking prescribed pain medication, if applicable, when your pain levels are typically at their lowest. Many people find that mornings, after joints have rested, or after a warm shower when joints are more flexible, are more comfortable times. There are also products designed specifically with seniors' needs in mind. Ergonomic personal devices with easy grip handles can reduce strain on arthritic hands. 3. Vibrating devices can minimize the need for repetitive movements altogether. While some may feel shy about purchasing such items, many online retailers offer discreet packaging and shipping, and some medical supply companies carry products specifically designed for adults with physical limitations. Remember, adapting your approach doesn't mean giving up pleasure, it simply means finding new ways to achieve it that work with your body's current needs and capabilities. 5. Psychological benefits. You might have noticed that self-pleasure activities help alleviate stress or improve your mood. Perhaps you sleep better afterward, or feel a temporary relief from anxiety. This isn't just a coincidence, there's solid science behind these effects. Self-pleasure triggers the release of several important brain chemicals. Endorphins, which are natural pain relievers, flood your system during arousal and climax. Dopamine, the reward chemical, creates feelings of pleasure and satisfaction. Oxytocin, sometimes called the bonding hormone, promotes feelings of well-being and relaxation. And prolactin, released after orgasm, contributes to that sense of satisfaction and sleepiness many experience. These natural chemicals are powerful mood elevators that can help combat depression and anxiety, which affect many older adults. Regular self-pleasure can be one tool in managing these feelings, providing a natural boost to your emotional state. 3. A common misconception is that intimate self-care becomes less important as we age. In reality, maintaining this aspect of life can contribute significantly to mental well-being, sleep quality, and overall life satisfaction. Research has shown that seniors who maintain sexual activity, including masturbation, report higher levels of life satisfaction and lower levels of loneliness than those who become sexually inactive. Regular self-pleasure may also help maintain cognitive function by increasing blood flow to the brain and releasing beneficial neurotransmitters. While more research is needed in this area, some studies suggest a correlation between continued sexual activity and better cognitive performance in older adults. Self-pleasure can also serve as a healthy coping mechanism during times of stress, transition, or loneliness. For those who have lost a partner or are separated from loved ones, it provides a way to maintain connection with one's body and experience physical pleasure independently. For many seniors, particularly those who grew up in eras when discussing sexuality was taboo, there can be feelings of shame or guilt associated with self-pleasure. It's important to recognize that these feelings often stem from outdated cultural messages rather than medical reality. From a health perspective, self-pleasure is a normal, healthy activity throughout the lifespan. 6. Prostate health, men/pelvic floor health, women. For men watching this video, you may have heard conflicting information about how self-pleasure affects prostate health. Some older advice suggested that frequent ejaculation might increase prostate problems, but more recent research points in the opposite direction. A landmark Harvard study that followed over 30,000 men for 18 years found that men who ejaculated more frequently had a lower risk of developing prostate cancer than those who ejaculated less frequently. 1. While this doesn't prove that masturbation prevents prostate cancer, it strongly suggests that regular ejaculation is associated with better prostate health. The proposed mechanism is fairly straightforward. Regular ejaculation helps clear the prostate of potential carcinogens and reduces inflammation. 1. Think of it as a natural way to flush the system, keeping the prostate functioning properly. For women, self-stimulation can help maintain pelvic floor strength, potentially reducing incontinence issues that commonly develop with age. During arousal and orgasm, the pelvic floor muscles contract rhythmically, essentially providing a natural workout for these important muscles. The pelvic floor supports the bladder, uterus, and bowel, and maintaining its strength is crucial for preventing urinary incontinence, which affects up to 50% of older women. While Kegel exercises are commonly recommended for pelvic floor health, the intense contractions that occur during orgasm can complement these exercises effectively. Many people incorrectly assume that these intimate activities have no physical health benefits beyond pleasure. In reality, they may contribute to maintaining important aspects of your physical well-being well into your senior years. 7. Regular self-stimulation can help maintain tissue health and blood flow to these areas. For women, this increased blood flow helps keep vaginal tissues healthy and elastic. For men, it helps maintain erectile function by ensuring regular blood flow to penile tissues. However, if you experience pain or discomfort during these activities, it's important to consult with a healthcare provider as this could indicate an underlying condition. For men, pain during ejaculation could signal prostatitis or other conditions that require treatment. For women, pain during stimulation might indicate vaginal atrophy, infections, or other treatable conditions. 7. Skin sensitivity changes. Perhaps you've noticed that your skin, particularly in intimate areas, has become more delicate or sensitive with age. Maybe you've experienced irritation or discomfort where you previously didn't. This is a natural result of decreasing collagen and changes in skin structure that occur as we age. As we move through our 60s and 70s, our skin undergoes significant changes. It becomes approximately 30% thinner than it was in our 30s. Oil gland production decreases by about 60%, making skin drier and more prone to irritation. The fatty layer beneath the skin also thins, providing less cushioning and protection. In intimate areas, these changes can be even more pronounced. For women, declining estrogen levels cause vaginal tissues to become thinner and less elastic. For men, the skin of the genital area becomes thinner and potentially more sensitive to friction or pressure. Many assume that increased sensitivity always means discomfort, but with proper care, these changes can be managed effectively. Using appropriate lubricants is perhaps the most important adaptation. 3. Look for products without irritating ingredients like glycerin, parabens, or artificial fragrances, which can further irritate sensitive tissues. Avoiding harsh soaps in sensitive areas can prevent further dryness and irritation. Consider using mild, fragrance-free cleansers specifically designed for sensitive skin. Staying well hydrated improves skin resilience from the inside out, as does maintaining adequate vitamin intake, particularly vitamins A, C, and E, which support skin health. If you experience persistent dryness or discomfort, speak with your healthcare provider. For women, low-dose vaginal estrogen creams or suppositories can sometimes help restore tissue health without significant systemic effects. These require a prescription but can make a remarkable difference in comfort and function. 8. Sleep quality effects. You may have noticed that self-pleasure activities help you fall asleep more easily. This isn't just anecdotal, there's a physiological basis for this effect. Sleep disturbances affect between 40 to 70% of older adults, with issues ranging from difficulty falling asleep to problems staying asleep throughout the night. Poor sleep is associated with numerous health problems, including increased risk of falls, cognitive decline, and cardiovascular issues. Self-pleasure triggers the release of oxytocin and prolactin, hormones that promote relaxation and sleepiness. 6. The physical exertion, however mild, combined with these hormonal changes, can create ideal conditions for falling asleep. A common misconception is that intimate activities are stimulating and might keep you awake. In reality, they often have the opposite effect, helping to release tension and prepare your body for rest. This natural sleep aid can be particularly beneficial for older adults who often struggle with insomnia but want to avoid additional medications. If you struggle with sleep issues, consider incorporating this activity into your evening routine. However, if you have a partner, be mindful of their sleep needs as well. Communication and consideration remain important at every age. Masturbation has been shown to improve sleep quality by reducing stress and enhancing mood. 7. The release of endorphins during self-pleasure can help create a sense of relaxation that makes falling asleep easier and more natural. 9. Privacy considerations. If you're living in a shared household, with adult children, or in an assisted living facility, you might have concerns about privacy for intimate moments. This is a valid consideration that many seniors face. Living arrangements change as we age, sometimes resulting in less personal space or privacy than we were accustomed to in earlier years. Nearly 20% of Americans over 65 live in multi-generational households, and approximately 5% live in some form of senior community. Many assume they must simply give up certain aspects of personal intimacy due to living situations. However, with some planning, privacy can usually be maintained. Establishing clear boundaries with household members is essential. This might include simple signals like a closed door, meaning, "Please knock and wait for a response." Using door locks when appropriate provides additional security, though be mindful of safety considerations if you have health concerns. Identifying times when you can expect privacy, perhaps when others are regularly out of the house or engaged in their own activities, can help you plan accordingly. If you live in an assisted living facility, remember that your room is your private space. Staff should knock and wait for permission before entering except in emergencies. If you have concerns about privacy in your living facility, consider speaking with the resident advocate or social worker. Remember that your need for personal time is both natural and deserving of respect. Maintaining dignity and autonomy includes having control over your private activities, regardless of your living situation. Now that we've covered these 9 important considerations, I'd like to address the emotional aspect of this topic. It's important to acknowledge that discussions about intimate self-care can bring up feelings of embarrassment or shame for many people in their 60s and 70s. You may have grown up in an era when these topics weren't openly discussed, making it difficult to seek information or advice. Cultural, religious, or family attitudes may have conveyed messages that these natural activities were somehow inappropriate or shameful. Rather than viewing these natural activities as something embarrassing or inappropriate for your age, consider reframing them as an important aspect of self-care and well-being. Maintaining intimate health is part of maintaining overall health, regardless of age. I encourage you to incorporate the information from this video in ways that feel comfortable for you. Perhaps start by discussing any medication concerns with your doctor, or exploring products designed to enhance comfort for seniors. Remember that natural changes in your body don't signal the end of this aspect of life, they simply mean adapting your approach. Many adults continue to enjoy fulfilling intimate lives well into their 80s and beyond by making appropriate accommodations for their changing bodies. To recap, the 9 key considerations we've covered today include cardiovascular effects, medication interactions, hormonal changes, joint health considerations, psychological benefits, prostate/pelvic floor health, skin sensitivity changes, sleep quality effects, and privacy considerations. Being mindful of these aspects can help you maintain this natural part of life in a healthy way. I want to emphasize that self-pleasure remains a normal, healthy activity throughout life. The physical and emotional benefits don't diminish with age, they simply evolve. Adapting to your changing body with knowledge and self-compassion allows you to continue enjoying this aspect of well-being. If you're experiencing specific concerns or difficulties, consider speaking with a healthcare provider who specializes in geriatric health or sexual medicine. Many larger medical centers now have specialists in these areas who can provide personalized guidance. Which of these 9 considerations surprised you the most or seemed most relevant to your situation? Comment below, I'd love to hear your thoughts, and your comments help others realize they're not alone in navigating these changes. If you found this information helpful, please subscribe to Wise Elderly Tips for more straightforward, practical advice on maintaining all aspects of your health and well-being as you age. Your subscription helps our channel grow and allows us to continue providing valuable content for our community. Thank you for watching today's video.